In this second video, the situation is that Jill has arrived at the emergency room and I am the nurse caring for her. She cannot move on one side of her body, nor can she communicate. I will be explaining to Jill the test that she will be undergoing and her plan of care. So when Jill first arrives at the emergency room, the first thing I will be doing is elevating the head of the bed. Next point thing I will be doing is assessing her airway and conducting any suction if needed. In addition, I will be providing proper oxygenation if she needs to by checking her oxygen levels. The next, I'll be monitoring the patient's vital signs, which includes her pulse, respiration rate, blood pressure, and temperature. We should be also checking her level of consciousness. How alert and oriented is she? Does she know where she is? Can she follow simple directions? Is there any progression or regression in the level of consciousness that she has since she's been in the ER? We will communicate with the healthcare providers using SBAR and talk about the diagnostic testing that should be completed, like CAT scan, MRI, EEG, and EKG. In addition, blood work will be done on Jill, which will include complete blood count, blood lipid tests, blood chemistry, coagulation tests, as well as platelet counts. We will be implementing safety precautions because she's not going to be able to move on her right side which will make her a fall risk. In addition, we'll be aiding her with her ADLs as Jill will not be able to complete them on her own. She's a fall risk for that as well. Therefore, putting up side rails is important and potentially having her on a one-to-one observation may be beneficial for her. Next important thing is to be having her call belt on her left side due to the fact that she's not going to be able to use her right hand, as well as communicate if she does need something. That way, if the nurse is not in the room, she's still able to communicate if she needs some help. Finally, we will communicate and explain to her about the treatment plan for her. I'll be explaining to her that she'll be seeing specialists like PTs, OTs, speech therapists. In addition, she'll have a nutritionist to come speak to her about her nutritional status and the plan they have for her. Also, there will be a potential change in her diet, so it's important that she's receiving the proper nutritional requirements to continually stay healthy. We will be also introducing to her social worker who can help her transition into her post-stroke treatment process and outside parties that might that need to aid her. We will also be explaining the medications that the prescriber has prescribed for her and the drug interactions and side effects of them. Overall, the last thing we would do is we would try to communicate with her in some type of way that we can see if she has any questions, possibly having her write something down with the opposite hand just because she's not able to communicate, just to make sure that she knows what we've been talking about.